Have you been experiencing nausea, upper abdominal pain, lack of appetite, acid reflux, or any of these symptoms listed below? Or you might be suffering from gastroparesis. Gastroparesis is a condition caused by a reduced amount of contents exiting into the small intestine due to weak muscular contractions of the stomach. This can result in complications such as malnutrition and erratic blood glucose levels, which can produce any of these symptoms listed below. When food cannot pass, it can obstruct the bowel or lead to constipation or infrequent bowel movements. This food can ferment and lead to the growth of bacteria. But how did you get gastroparesis to begin with? More than 50% of all gastroparesis cases are idiopathic, meaning they have unknown causes. However, the most common non-idiopathic cause is autonomic neuropathy, which is the damage of the nerves that innervate the stomach and small intestine, in particular, the vagus nerve. The most common cause for autonomic neuropathy is uncontrolled diabetes mellitus, as high levels of blood glucose cause chemical changes that make it harder for the nerves to send signals and harms blood vessels that send oxygen and nutrients to the nerves. Other causes for the damage can be post-surgical, medicinal, neurological, hypothyroidism, autoimmune, spinal trauma, viral, or amyloidosis. If damaged, the muscles of the stomach and small intestine cannot function normally, and movement of food through the digestive tract is then slowed or stopped. Gastroparesis can be treated with medications such as metoclopramide or erythromycin, to name a few, which can help to increase contractility within the GI tract. When chronic nausea renders patients unable to take medication, an implantable gastric device can stimulate the muscles of the lower stomach to reduce the symptoms. Another option is pyloromyotomy, which involves the widening of the gastric outlet. This can be done by either cutting the pylorus muscle laparoscopically or endoscopically, or by injecting botulotoxin into your pylorus to relax the valve. Gastroparesis can be managed by small low-fat and low-fiber meals 4 to 5 times a day and by increasing our consumption of liquid nutrients. We should avoid carbonated beverages, alcohol, and smoking, aim for normal blood glucose levels, and remain in an upright position during and after a meal. Nasovaginal or jejunostomy tubes can also be inserted through your nose or belly respectively and into your small intestine. This allows food to skip your stomach and enter your intestine directly for absorption. Intravenous options are also available. Behavioral or cognitive therapy can also help patients to cope with symptoms and achieve a sense of control. But as with all chronic diseases, education of patients about the illness and the support of family and friends are very important.